Testosterone cypionate, deemed by some as the holy grail of men's health medications, and for good reason. I'm going to tell you why here in a second, but I can tell you, out of all the prescription meds that we write for men's health, this is one of the medications I see as the most commonly incorrectly prescribed medications. You're going to want to watch this video to the very end. I'm going to give you some really good input, not only as a prescribing clinician, but also as a TRT patient myself for almost 5 years now. Testosterone is an anabolic hormone that is responsible for a plethora of other health benefits in the human body. But I think the question that most people have, and the question that naturally arises, is what is testosterone cypionate and how does it work in the body? We're going to talk about that today, and we're going to go into some detail. Let's start first with what exactly is testosterone cypionate. As I alluded to earlier, it's a form of testosterone. There's different types of testosterones based off of the chemical makeup and the esters within the medications, but testosterone cypionate specifically is a form that we prefer, and it's usually the medication that I will prescribe for my male patients as first-line treatment. And the reason for that is because it has a steady and consistent half-life. It has a half-life of somewhere around 5 to 7 days. This is important because the injections of the medication, when given correctly, it allows it to be slowly absorbed into the body. Starting dose for testosterone cypionate is anywhere between 100 milligrams to 200 milligrams once to twice a week. For example, we might start a patient at 100 milligrams a week, but we'll typically break that up into 150 milligram dosage and another 50 milligram dosage spread out within a 7-day period to get the benefits of that half-life absorption of the medication. So increased energy, decreased fatigue, increased muscle mass, increased sex drive, mental clarity, as well as other things like improved ability to burn fat, improved metabolism. As far as dosing testosterone cypionate, it's typically only in injection form. Now there's two variants to that. You can do it in subcutaneous, meaning you inject into the fatty tissue, or you can do what's called IM, intramuscular, and it's injected into a large muscle, usually the glute, sometimes the deltoid, and that allows the medication to be slowly absorbed over a more steady rate over a time period of somewhere around 5 to 7 days. The reason we'll dose it in 2 separate increments within a 7-day period is to improve the consistency of the medication and to eliminate any peaks or troughs in that medicine. Starting dosage is usually somewhere between 100 to 200 milligrams a week. And like I said, that's either IM or sub-Q, but the dosage a lot of times is based off a patient's metabolic rate, how quickly they absorb the medication, as well as height and weight. Sometimes we'll use BMI to approximate a correct dosage, but usually the gold standard for determining what dose you're going to start at with the testosterone is based off lab work. Typically the goal is to get men's total testosterone levels to the higher ranges of optimal or normal. And so typically when I'm treating patients, I want to get men's levels up to somewhere between 800 to 950, sometimes even up to 1,000, but we want to stay within the optimal but higher range of normal. And normal can be considered anywhere from 250, 300, all the way up to 900. And so that's difficult for patients because you may go to your PCP, you get your labs drawn and they're 300, for example. Your primary care doctor may say, well, you're normal, but if you're still having symptoms, that's not normal. And so we want to keep you within the normal range, but if you're having symptoms, we want to have you at the higher end of normal. And so for an example like that, a patient who might have a total testosterone of 300, for example, if we get their levels up to maybe 800 or 850, that patient is technically still within the normal range, but their symptoms will typically be resolved and they'll get an improvement in quality of life. Common feedback that I get from patients when they're on the lower end of normal, we optimize their levels, get them to the higher end of normal, and patients will describe to me as it's completely life-changing. Since we're talking about labs, of course, the total testosterone is very important, but we also want to look at the full panel of labs, right? So although total testosterone is usually a biomarker that we start with, we also will assess other things like the free testosterone, for example. And a lot of times the free T is more important than the total T. Now, we use them together and they're labs that we use to treat synergistically, but the free testosterone is the amount of testosterone that is bioavailable in the bloodstream. Your total testosterone is the total number that comes out on the lab panels. Now, of course, we look at other things as well, and it's very important when you have patients that are on TRT to monitor other things like their estradiol levels, their DHEA, their sex hormone binding globulin, LH, FSH, all these other indicators that we look that correlate and work with the total and the free testosterone, and it gives us a better picture of what's really going on in your body and how well the medications are working. So that, alongside with symptom resolution, is very important feedback that we'll get from patients to determine whether the treatment regimen that you're on is appropriate and or needs to be adjusted. Just like any other medication, of course, there's side effects, and testosterone is no different. Some of the labs that we have to look at, like I had alluded to earlier, is estrogen levels. And so testosterone essentially is converted into estrogen, and that's normal, but we want to make sure that the estrogen levels are also within optimal ranges. Estrogen is important hormone for women as well as men, and it does have some therapeutic benefits to it, but you have to watch it very closely, especially if you're injecting synthetic testosterone. And so that's something that we look at very closely with our TRT patients. Of course, another common side effect can be gynecomastia, and that ties into what I had discussed earlier as far as monitoring estrogen levels. Now, I typically don't indicate starting patients on a SARM or an estrogen blocker unless it's absolutely necessary, because you do need some estrogen. We just need to keep it within the normal healthy ranges for men as well, and that will eliminate a lot of the side effects that can happen with TRT. As I had mentioned prior, testosterone cypionate can be a very impactful medication for men's health. And in fact, it helps a lot of men every day. And a lot of them will say they have a better quality of life after optimizing their testosterone levels. Now, if you're curious about TRT or just getting your labs checked, I would encourage all patients to go to our website, hormoneexpertsclinic.com. We're active on the social media platforms, but on the website, we have blogs and more educational information that you can use just to read up. But I would tell you, go to hormoneexpertsclinic.com, fill out a patient intake, and we'll get you started, and we're certainly happy to help you.